So there are now more than 2.6 million cases of COVID-19 globally, including more than 845,000 in the United States. Over the last 1 to 2 months, we have in New Hampshire tested 16,809 individuals, residents of New Hampshire, for COVID-19, and there are an additional 424 people currently undergoing testing for COVID-19 in our state. We are announcing today that we have identified 1,670 people with COVID-19. That is an increase of 84 individuals from yesterday. 218 of these individuals, or close to 15%, have required hospitalization at some point during their illness. That's an increase of 5 individuals from what we announced yesterday. And sadly, a total of 51 individuals, 51 people, have died from COVID-19, either directly or due to COVID-19 related complications. That's an additional 3 people from what we announced yesterday. All 3 of these individuals were associated with institutional outbreaks such as long-term care facilities or nursing homes. Out of the 51 individuals who have died from COVID-19 in our state, 30 or approximately 60% of these individuals have been associated with some of our institutional outbreaks, which is why we're putting such a heavy emphasis on protecting this more vulnerable population. Now, the last couple of days we have reported higher overall numbers of COVID-19. We reported 99 new people yesterday diagnosed with COVID-19 in combination with the 84 new people today that we're announcing were diagnosed with COVID-19. We do not believe that this means that there's an increase in the spread of COVID-19 in our communities. Rather, we believe this represents an increase in the testing and is a direct result of the efforts we have been making to test more broadly people with symptoms, people in long-term care and other congregate living settings for COVID-19. For example, based on the numbers we are reporting today and have reported yesterday, we have tested roughly 800 to 900 individuals per day for COVID-19. Now that compares to about a week ago where we were testing 400, 450 a day. So in a very short period of time, we have managed to approximately double the number of people that we have been testing in the state. We plan to continue to ramp that up because testing is an important strategy for not only understanding the total burden of infection in our state, but testing becomes an important tool for our ability to rapidly identify, respond, and suppress or contain clusters of infections as they're identified. And I think you're seeing that play out, particularly in nursing homes, long-term care facilities, assisted living facilities, where we're particularly going in and aggressively testing. We are looking at also expanding testing for other individuals within our community. So the numbers will increase. Again, we do not believe that we're seeing an increase in overall community transmission. We also, however, have not seen yet a decrease in the numbers. So right now, what is going to have the greatest impact on controlling the spread and decreasing the transmission of COVID-19 in our community are those social and physical distancing measures that we continue to encourage everybody to perform. So please, I don't want to sound like a broken record, but please stay at home as much as possible and only go out for the essentials. Please continue to keep a safe distance when you are out of at least 6 feet from other people. If you're in a public setting where social distancing may be difficult, we encourage and recommend that you wear a cloth face covering or a cloth face mask. Something ideally that is reusable and washable in order to save the surgical grade cloth masks, the surgical grade face masks for our healthcare providers, first responders, and those who are on the front lines. And please continue to practice good and frequent hand washing and hand hygiene. And we realize that this time is stressful and a strain on everybody. Thank you for all the work that you are all collectively doing to help control and prevent the spread of COVID-19. And with that, let me hand things over to Commissioner Shibinette to give an update. Thank you.
Thank you. I wanted to do a couple new announcements today on some new outbreaks and also give updated numbers on the current outbreaks we have going forward, the ones that I've already announced, what their numbers look like today. Just to note that it takes several weeks of having no positive tests to be able to clear a facility from an outbreak. So although I'm still announcing numbers for some of those facilities, some of those facilities have had several days with no new positives at all. So 2 new facility outbreaks that I want to talk about: Dairy Health and Rehab in Derry, New Hampshire, with 8 residents testing positive, 5 staff for a total of 13. Second new outbreak is Pleasant Valley Nursing Home in Derry, with 4 residents testing positive, 3 staff members for a total of 7. As with the facilities over the past couple of weeks, as soon as we learned of the first positive person in that facility, we went through and either tested all the residents on the unit or all the residents in the building, and then set up priority testing with our Convenient MD testing team or with our mobile testing team for the state to test all of the staff in that facility also. So they've either been tested or set up to be tested. So other numbers, just to update: Bellamy Fields in Dover, 33 residents positive, 10 staff for a total of 43. Easter Seals, Manchester, 44 residents positive, 56 staff for a total of 100. Hanover Hill in Manchester, 47 residents, 40 staff for a total of 80. Huntington of Nashua, 23 residents positive, 17 staff for a total of 40. And Salem Woods, 21 residents positive, 5 staff for a total of 26. Thank you.
Thank you, Commissioner. Earlier this week, we want to touch upon a few different issues here, and then we can open up for questions. But earlier this week, the state received the second half of our CARES funding, which is quite exciting in that there's now $1.25 billion deposited into the state accounts, and that's an incredible responsibility and obviously something that we take very, very seriously. And as I've repeatedly stated, we're going to dispense those funds in a transparent, responsible, accountable manner. We're going to create guidelines with all the different business sectors, nonprofits, and opportunities that we can provide that relief out to, and we're going to do it in as fast of a manner as we can, laying out a strategy. As we speak now, the Stakeholder Advisory Board within the Governor's Office for Emergency Relief and Recovery is actually meeting right now. They've been meeting on a daily basis with various stakeholders from across the state to get their input and design guidelines and tools and mechanisms to allow these relief efforts to come. $1.25 billion is a lot of money. There's no doubt about it. But given the incredible magnitude, scope, and economic impact that this has had, and with families and businesses and nonprofits across the state, I think we're going to find that that money is going to be spent wisely, but obviously very, very quickly. We hope that there's other opportunities down the road. We've been communicating with the federal delegation, both Senator Hassan and Senator Shaheen, about what other needs and opportunities might be out there, what we're seeing on the ground level in terms of businesses that may not have been able to participate with the PPP, Paycheck Protection Plan program. It's a great program, over $2 billion in loans put out in a very short time here in New Hampshire, but there were also a lot of gaps in that system, and whether it's through the state or through other federal opportunities, we want to make sure that folks do have a chance to keep their business alive, keep their doors open, allow those employees to keep working in a variety of different ways. It might be a different look of what they were doing just a couple months ago until we get through this. And there will be an end here, but we're definitely and unfortunately not there yet, given the very sobering data that was presented just over the past couple of days. Another 180 or so individuals in the state with COVID. Those are very, very large numbers. But again, a product of increasing our testing and expanding our availability of testing. Those are very positive pieces to this puzzle. And also, we just wanted to address over the past 24 hours, we did get a ruling from Judge Anderson concerning the lawsuit that was brought by the legislature, or members of the legislature, I should say. He dismissed the lawsuit, which we're obviously very relieved about. And in his words, to stop or even delay the governor from distributing purely federal funds intended for the benefit of the public in the midst of a global pandemic would be contrary to public interest. And obviously I could not agree more, and we thank Judge Anderson for his ruling and ruling in such an expeditious manner. Would also like to thank Solicitor General Dan Will, who presented the case of a whole litany of data and information and evidence brought for the case in a very short time. I think he and the entire staff over at the Department of Justice did a tremendous job. To that end, though, the Bipartisan Legislative Advisory Board continues to meet. They met yesterday, and they'll be meeting tomorrow as well. And with this structure, they'll be able to move quickly, move at the speed of the go for office, at the speed of the office to get the information from stakeholders, put together a plan, and hopefully get it out to the public in very short order. Last night, we received guidance from the federal government, guidance that we have been waiting on for approximately a month from the Department of Treasury, laying out how we can spend the 1.25 relief and recovery dollars that we've now received. And while the guidance documents did provide a great deal of flexibility, we do continue to have specific questions, and we'll be integrating with folks, whether it's in the Department of Treasury and other aspects of the federal government, to make sure that we understand these guidelines very clearly. What we don't want to do is spend the money in a way or misinterpret how we can spend the money, because ultimately the federal government could come in and claw that back, if you will, if we're not adhering to those guidelines. So we have to understand the rules of the game before we take a step forward, but hopefully in the next 24 to 48 hours we'll be able to more clearly define what those rules are and lay out a plan and a strategy for the entire state in terms of where we're going. What we do know is that there is flexibility to spend these funds to provide relief for COVID expenses to our small businesses, nonprofits, public institutions. If there were COVID-related expenses at the state, COVID-related expenses for cities or towns or whatever it might be, then these funds are definitely available to recoup a lot of those costs, and that's great to know. We also have flexibility to provide direct business economic relief. For example, if businesses weren't able to participate in the PPP program because it had run out of money or they just didn't get through the queue, we'll have a lot of flexibility to provide economic benefit to those businesses and nonprofits that have all been impacted in one way or the other through this COVID epidemic. Unfortunately, there are areas where we now know that we cannot use this funding for. This money cannot be used for by the state or municipalities to address revenue shortfalls. Cities and towns must be very careful in how they approach not just today's budget but future budgets. And the days of spending like it's 2018 are behind us. And so we're cautiously moving forward, tightening our belt at the state level, and we're reminding municipalities and mayors. I was on a call with all the mayors this morning, reminding them that they have to be very careful about budgeting. There is hope that down the road maybe there could be another round of federal relief, if you will, that allows the state to recoup shortfalls or allows us to pass through some of those dollars to cities and towns to recoup their revenue shortfalls. Right now that does not exist, and we have to be cognizant of that. It does not allow the guidance does not allow use of CARES Act funding to backfill our budgets. And despite what some folks have said out there, this is about, right now I just want to clear any rumors that might be flying. We cannot backfill our budgets, we cannot backfill our revenue shortfalls, and we just want to make sure that folks understand that that is very clear in the guidance document, and we have to follow those rules very strictly. We have had talks with our federal delegations many times, and we'll continue to advocate for changes of the CARES Act that can allow us to do so in the future, but right now it doesn't look like that's a possibility. The CARES Act 3.5, as some folks are calling it down in Washington, it looks like the Senate has passed it, and hopefully it'll make its way through the House and be passed in the next 24 or 48 hours is what we're hoping. That has, right now, our understanding, it has about $320 billion of an extended PPP program, the Paycheck Protection Plan program. The hope is that if they do, and hopefully they will extend it, it'll also come with some refined guidance to make sure that some of the folks that fell through the cracks, some of the loopholes that allowed very, very large companies to get a hold of these funds, even though technically it should have been capped at 500 employees or less. some of those loopholes are taken care of, and again, doesn't just allow a first-come, first-served basis, but really does a bit of a deeper dive to allow some of the smaller business, especially those here in New Hampshire. 90% of our businesses in New Hampshire are small businesses. Some of the smaller businesses to take advantage. It was great to know that over 11,500 businesses in New Hampshire participated in the first $2 billion of funding. But there's a lot more need out there. There really is, and so hopefully this will be able, this CARES Act 3.5 that it looks like will pass in short order, will be able to address that. Secondly, out of that bill is about another $100 billion from the federal government, about $75 million for hospitals, an extension of the hospital support program that the first CARES Act did, as well as about $25 billion in additional testing opportunities. Testing, the limitations of testing in the state is not a factor of dollars at all. It is great that the federal government is putting more dollars there and will allow us to kind of recoup a lot of those costs. But it really has not been a factor of dollars for the state. It's really a matter of supply and demand. Unfortunately, I should say fortunately, we have been able to really mitigate the spread of the virus. We have one of the lowest mortality rates in the entire Northeast. That's very good, but it means we don't necessarily get top preferential treatment when it comes to getting all the testing materials. We've had some success over the past week. We have thousands of more swabs coming in. We have more reagents coming in. We have more testing supplies that go along with the actual testing devices themselves. Not quite where we'd like it to be, but we do have more coming in, and that has allowed us to really increase our testing capacity in just the past couple days, and we hope to keep building on that as we go forward. The last thing I wanted to talk about is something that has been recognized and brought up with us with a variety of different businesses across the state. The Business and Industry Association, the BIA, as it's known here in Concord, that advocates on behalf of businesses. Members of the Chamber of Commerce have come to us. When we crafted the budget and negotiated the final version of the budget in September of 2019, one of the stipulations that the demands made upon us, and that we agreed to, was that if there were catastrophic losses in revenue, then the business tax cuts that were supposed to go into effect would effectively be wiped out and really trigger a tax increase. Again, the idea, given the strength of our economy, was that was just never going to happen because you'd have to have a catastrophic economic collapse for those business tax increases to be triggered. Unfortunately, that's exactly what has happened. We've hit an economic collapse like no one could ever have imagined in very short order. But with that, I'll tell you this. I still believe very strongly that in asking businesses in a time of their most economic strenuous times, when they are strained to the hilt, asking them to put more into taxes to the state is absolutely wrong. It's the wrong approach. It's the wrong thing to do, and it puts a lot more strain on a group and a sector of the economy where we're really trying to boost up. So to ask more out of them, it doesn't really make much sense, to be frank about it. So today I'll be writing a letter to the legislature asking them to revoke those potential tax increase triggers that potentially could come down the road and likely will come to be implemented in January of next year. I think, again, we're not going to be out of this by any means economically. We'll have a lot of relief efforts going forward, but again, to have those tax increases move forward, I think would be the absolute wrong approach. So we'll be asking the legislature to revoke those immediately. With that, I guess we can open up for questions for folks in the room.
You mentioned on the revenue shortfalls at the state level, your hope is that Washington will do something. But Senate Majority Leader Mitch McConnell has said he thinks that the states should go bankrupt. What's your reaction to that?
That's a ridiculous statement, that the states should go bankrupt. Anyone who's saying that in the Senate doesn't know what's going on in states, doesn't know the pressures that states are under and the sacrifices that we've had to make. And to have a state just up and go bankrupt and forego all the programs, all the benefits that the state has to operationalize, manage, and institute for our citizens is frankly a ridiculous statement. So to anyone listening, if you're in the Senate, I don't care whether you're a Republican or a Democrat, it's not just about giving us more money, just give us some more money. Of course, there needs to be accountability in that. There has to be guidelines around that. There have to be goalposts. But absolutely, the wrong thing to do is to say in a worldwide pandemic, we're going to let all the states go bankrupt, because that's effectively what will happen. Virtually, we're one of the most economically healthy states that we have in the country. And to say that states should just go bankrupt is a very dangerous statement, I believe.
So on the guidance you received from Treasury, correct me if I'm wrong, you had indicated before that you at least hoped that there might be some opportunities for municipal governments to received some relief that you did not anticipate the state government getting, but it appears that that didn't happen.
It didn't happen. So there were 2 or 3 areas where we were, in previous early conversations with the federal government, we were under the impression there'd be some ability for us to use some of these funds to match against Medicaid or other social programs. Looks like that is not going to be allowed. We advocated for, and it sounded like there may be the ability for us to pass through, even though the state could not recoup revenue shortfalls. Maybe we could help the cities and towns to recoup some of their revenue shortfalls. That unfortunately hasn't happened. We can help them with COVID-related expenses, but it doesn't look like, I mean, we're going to get some more guidance, and maybe there's some wiggle room in there, nothing that we've seen yet. But at first blush, it doesn't look like some of the things that we had hoped and we thought were going to be in there have come to fruition.
How about on the restaurants and other businesses that can get the COVID relief?
Yeah.
On the Gopher call yesterday, one of the business representatives was suggesting that part of that relief could be moved to them to help pay property taxes. Is that allowed under the guidance?
I believe so. So what we can do is there's a lot of flexibility in terms of the funds that we can provide to small businesses for a variety of reasons. It doesn't just have to be directly COVID-related. COVID-related qualifies with businesses as the economic distress driven by COVID. So as long as there's some economic distress there that can be identified, there has to be accountability in that system. We can probably move funds to those businesses and give them the flexibility in terms of how they would spend it.
I know you've got a couple of groups still working on modifications to advise you on extending the stay-at-home order. What's your time frame now? Is it probably going to be next week?
Yeah, I think so. So the question is about the stay-at-home order, the extensions of that order, and extensions of any of the limitations we've put on businesses and, frankly, our communities as a whole. I think sometime next week, mid to late next week. I was hoping to have something earlier, but unfortunately, the data just isn't supporting pulling back on too much right now. We're going to have some plans in place. We may have some guidance documents out there for what I would call the low-hanging fruit. So we're looking at hospitals. We're looking at some of the other business sectors where we think it might be easier to get them up and running. Doesn't mean they're going to be up and running on May 5th necessarily, but we'll at least have some of those initial guidance documents that the Open Up Task Force is looking at to create these new models, allow businesses to get prepared for what these new guidelines might require, bring some of the staffing back in. You know, they usually need time to staff up, and sometimes there's even costs to get things up and running. And again, not everything is going to open on the same day. Certain things can open up maybe in a week or two, and other things maybe can't open up for a month or two. And right now, you know, I got to give credit to the guidance document put out by the federal government. It really, again, not to be repetitive, but it said if you have 14 days, this is the president's document, of positive trending data, then that's probably a good sign you can move to the next step. And the next step might be opening this or that or creating guidelines for this business segment or that part of your community. And then you look at another 14 days of positive data to take the next step. So it's a very phased, gated approach. It's probably the right approach. Now, we may make adjustments within that document that more meet New Hampshire's needs. We're a tourism state. We're a high manufacturing state. So we may focus on certain areas that other areas might not, that other states might not. But it's a good approach, I think. And so we're going to take that type of phased approach. So are we going to continue the stay-at-home order beyond May 4th? In some fashion, it's very likely, yes. It's not just going to go away on May 5th. I can't foresee that right now because we're just not going to have the data to support that. But if there's some flexibility that we can provide there, either geographically, demographically, in some manner, we want to provide flexibility where we can, and where, again, anything we do, whether it's guidance documents for the private sector, the public sector, whether it's what we do with the stay-at-home order, everything will be run through the Department of Public Health because that has to be the preeminent concern and will remain to be as we go through the entire crisis.
Commissioner Gary Bateman tonight is supposed to give more guidance on what he's looking for in terms of returning professional hockey. As you know, Manchester has been in consideration. There have been up to 20 communities. Yesterday, Bateman said we may have as many as 4 places where we have division matchups. What's your sense? Is New Hampshire still in the running for this?
I had a conversation with the commissioner last week, and it was a great conversation. I don't think they were near a point of making a decision. I told them that we definitely had an interest, and again, we wanted to work with them on logistics and timing and all of that. We just were here to be helpful, and that was about it. And so again, I haven't talked to them since then, so I guess we'll see where they are. Maybe later tonight. Who knows? There's a big announcement. I don't know any more information than that right now. Paula, how are you?
Hi, good to see you.
Good to see you.
I would like to ask you about Bike Week. June,
Yes.
it's coming up. It's kind of an outdoor event, but it requires hospitals and restaurants and places for people to stay. Where are you in terms of recommendations on that one?
So the question is about Bike Week up in Laconia. I was on the call with the mayors, and Mayor Hosmer brought that up with me out of Laconia today. That's a real tough one. That really is. I mean, I love Bike Week. It's a great opportunity for the state. It's still down the road a little bit. We're still about 2 months away, maybe 7 weeks away, something like that. So there's still some time to try to hopefully get some new data and try to get something open in some fashion. It'll be I'd be curious to see, will people actually come, even if we did open it up, and how can we do it in a safe manner? If you've been to Bike Week, there's a lot of events where people are in close proximity. There's a lot of folks from out of state. Those are very dangerous pieces of the COVID recipe right now, if you will. And so I'm not sure how that would look and frankly, if it can go on. I mean, we would like it to go on, but we'll be working with folks of the Bike Week Commission, their Chamber of Commerce. And remember, Bike Week is kind of taken on an across the state type field. There's events that go on all over the state, not just in Laconia anymore. And so there's opportunity there. But given that we really are pushing back against the tourism aspect in the short term, I don't know where we'll be in June. I mean, I hope we're in a better place and we could open things up, but as of right now, we definitely couldn't. Hotel rooms, you're really inviting a lot of folks from areas of very high COVID incidence and mortality to come into the state, and that's not a good thing for anybody. Ultimately, that could lead to a lot of problems. So we'll be working with them and see if there's a solution there, and then probably no firm decision until as we get much closer. We'll try to string it out as long as we possibly can, and hopefully we have some good data that supports some of the new models that we might enter into.
So on the testing supply front, you indicate there's some progress, but you'd like more. I mean, whom with you with whom are you in touch with in the Trump administration on that front?
Within the administration, we talked to a little bit of everybody, folks at HHS, FEMA, especially a lot of the testing supplies that get approved by the FDA. For example, the Abbott rapid test, that's really, all those supplies are proprietary to Abbott, and FEMA controls the supply chain for all of it. So we're kind of begging with FEMA to get as many of those supplies as we can. On the more traditional tests, maybe it's the Fisher test or the other more traditional Abbott test. I think it's called the M2000. It's a device that Dartmouth-Hitchcock has. They've been able to get their supply chain up, and we've been able to get our supply chain up to have more, everything from swabs to reagents. We have a little more flexibility with the viral transport media, not to get too technical, but the FDA has given us some flexibility there that has opened up opportunity to use those devices a little more readily. And leaning on Convenient MD, LabCorp getting their lag time, their turnaround time from about 10 to 14 days down to 6 or 7, and even more, they're actually giving us an even faster turnaround time for some of our long-term care facilities. So constantly negotiating with everybody to try to get bumped up in the line with FEMA, with the actual suppliers themselves. I've been on the phone with the CEO of Fisher, who supplies stuff. He has great connection to New Hampshire, and we've been working with him to try to get pushed up into that chain. With the swab manufacturer, we've been talking to them, trying to get pushed up into the chain, and that's been very helpful. Commissioner Shibinette was very successful in bringing thousands and thousands of swabs into the state just in the past week. So it's like PPE, we're constantly scrounging. The difference between testing capacity and PPE is that most of the testing supplies have to be gathered within the United States. I think Governor Hogan in Maryland struck an amazing deal in South Korea and brought in a lot of supplies from South Korea, but those are very few and far between. PPE, we're looking within the United States, and we've gotten a lot of success with our supply chains. Maybe it's 3M or other manufacturers in the U.S., but I'm also going outside of the U.S. We're going to other countries and other places that can manufacture those types of supplies a little more readily.
Kushner over any of this stuff?
Do I have any contact?
Have you had any contact with Jared Kushner?
With Jared Kushner?
Yeah.
No, I haven't talked to Jared Kushner about any of this. Is he involved? I don't even know. No.
Can we hear from you and Dr. Chan on how we're supposed to interpret the curve now as we see testing ramp up? Because the numbers are going to be different
Right.
with the capacity to test more. How is
Yeah.
Joe Average supposed to look at this? Because it's going to
Yeah.
look like it's going up quite a bit. How
Sure.
are we supposed to interpret that?
I'll bring Dr. Chan up. While I bring him up, I'll tell you this. In the guidance document given by the federal government, when you look at the better numbers over 14 days, one of the areas where they do say you can look is the percentage of your positive tests. So even if you are increasing the number of tests, as long as your percentage is getting better, that's usually a sign that you're on a better trend. And one of the things I always also go back to is if you're looking just beyond that, where we are with our hospital beds, hospital stays, and the mortality rate, those are I think, much more accurate equalizers in terms of how we're doing compared to other states. Because whether you test 2 people or 2,000, if you have symptoms that require hospitalization, you're going to go. And unfortunately, that's just a fact of where you are in this entire process. So again, that's one of the metrics that I traditionally use. But in terms of the actual epidemiological trends, I'll turn it over to Dr. Chan.
Thank you, Governor. No, and that's a great question, and I think the answer is that there's not any one specific number or metric that we can really rely on to show us when transmission spread in a community is downtrending. The number of cases or the counts on a daily basis of COVID-19 is a very crude measure, as you point out, because testing can impact that. So as the governor mentioned, we can certainly and will continue to look at the percent of tests that are positive. If you remember early on when we first started to detect people infected with COVID-19 in New Hampshire, we started to do more testing. Approximately 2, 3, 4% of people were turning up positive for COVID-19. Now that number, as has been seen in most states, has increased. We're closer to 10, 12% of tests that have been positive for COVID-19. So as we test more, you're absolutely right, the numbers will go up. But as we're out there testing more, when community transmission decreases, that percent of tests that are positive should decrease. So that's one way to help consider, take the increased testing into account. The other point is that I think we're not just looking at the number of cases, we're looking at hospitalizations. Both total numbers of hospitalizations, daily census of people hospitalized for COVID-19. Actually, the hospitalization data is probably more reliable for looking at some metrics like doubling times and some of these epidemiologic measures of how rapidly the virus is transmitting person to person, because we capture, we think, most people hospitalized, if not everybody, with COVID-19. We're obviously monitoring outbreak situations very closely. As community transmission decreases, we would expect the number of outbreaks that are occurring to decrease. We would expect outbreaks to be brought under control. And then there are some more general measures which we track on a yearly basis with influenza season, for example. We have a surveillance system in place that looks at outpatient and emergency department visits, helping to give some estimates of the number of people going in for what we call influenza-like illness or respiratory infection type syndromes. This is what we call syndromic surveillance type data. This can also give some clue, and this was mentioned in the federal plan for the gated, phased approach to opening things back up. Those numbers can obviously be influenced by people seeking health care. Maybe in this current society, people are not seeking health care. They're not going into a doctor's office or an emergency department as much as they might. But we take all this data together to give really some idea about what transmission is happening in the community. It's not based purely on the total number of cases that are being diagnosed.
Do we know how many people at nursing homes have been tested, Dr. Chan, or maybe Commissioner, maybe you know?
I don't have the exact number. Where certainly there have been quite a few, both staff and residents, but I don't have an exact number, unfortunately.
I'm also just sort of curious about the mechanics. There seems to be a little bit of confusion out there among the nursing home communities exactly how Convenient MD is working, like how that's paid for. Obviously insurance companies have waived some of the testing costs, but there seems to be, you were on the same call, I was listening to the call where the questions were about that. Can someone explain the mechanics of Convenient MD's administration of these tests?
Sure. So Convenient MD has been in touch with most of the facilities that they're testing out over the next 2 weeks. So they have a schedule that goes out the full, I think it's now 14 days left in their contract for these 2 counties specifically. They've been in contact with each facility. They've set up dates and times to have everybody tested. I know they've done, I'll give an approximate number, about 1,500 staff tests already just in less than a week. They're sending those samples to LabCorp. Anybody that LabCorp can't bill insurance for, they're billing it back to Convenient MD, who's using it, using our contract to pay for that portion of it. So the facility should see no cost at all. The employee, it's him or herself, should see no cost at all. Yesterday, I talked to the CEO of Convenient MD, and they fully expect to obtain between 6,000 and 6,600 specimens, which is exactly where we expected them to be. We're about a week away from really evaluating what's the percentage of positives. They've definitely found asymptomatic positive people in that test group they've done so far. So we are discussing now with the what the ability is to not only expand the counties and the nursing homes that they're testing, but also expand their testing in general. As we try to ramp up our testing, we also want to see, just general community clinics that doctors can refer people to get testing. And we've seen these stand up all over the state, but as we develop a really comprehensive testing strategy, we need all the partners that we can get.
Do we have any idea? One thing that also came up on this call was that there are, which was news to me at least, but maybe I'm just ignorant, that there are in fact positive COVID-19 nursing home employees who are still on the job in some facilities. Do we have a sense of how many of those folks are still working?
I don't have the exact number of those, but some of them are in our outbreak facilities that have had, let's say, one entire unit. The residents are COVID, or they've created a COVID unit. Because we have found so many asymptomatic healthcare workers, one of the things that public health put in place was guidance around an employee continuing to work with only COVID patients. So you have an asymptomatic COVID healthcare worker working only with patients that have had positive COVID tests. So that involves a lot of decisions around separate entrances, separate break areas, so that there is no crisscross of those employees at all.
I had a question about demographics. I was very pleased to see the weekly report come out yesterday, and I was expecting just to see the age breakdowns, but there was information about actually what race populations are being, and it looks like there is more of an impact on the Hispanic and the African American communities. Is that something that you were expecting, or is that kind of a surprise to you?
It was not a surprise to me. I think it's consistent with the numbers that we're seeing around the country right now. So not a surprise. But, as our numbers grow, right, we still have limited 12,000, 13,000, 14,000 people tested. As we test more and more people, I think that'll be more create more relevance and more definitive data around those numbers. It's still early on to say if that's a trend or a pattern.
Commissioner, can you weigh in on that? We had spoken to one of Dr. Chan's counterparts up at Dartmouth, Dr. Altamari, who was saying the curve is still in a gray area right now. Is there a ballpark for when the data is enough to say we do have a pattern, we do have a line we can follow here? When would that be?
I think that's different depending on what data you're looking at and for what purpose. For looking for a downward trend, we would have to see consistent decrease in not just positive cases, but percentage of positivity, hospitalization rates, all of those things for several weeks before I would be comfortable saying we're in a consistent downward trend. So I think it depends on what data you're looking at and for what reason.
So, a two-part question about, there was testing on Wednesday and Thursday last week at the New Horizon shelter in Manchester, both of the staff and the clients. And the question is, how soon are they going to be notified of their results? And how does the testing work if they're tested on Thursday and you have a mixture of positive and negative people all mixed back into the same shelter?
Sure. So all the test results from that testing session are back. Anybody that had tested positive, which was not many. We have that we know of 2 unsheltered people in our state in isolation right now for a positive test. Not necessarily just from there, but we have 2 in general statewide. So when they did that testing, right, the Manchester Public Health Department did a really great job working with the shelter on really just segmenting the population, who was symptomatic, who was not symptomatic, who was exposed to the positive tests, who were not. So the people that were exposed that had close contact, they were quarantined in a separate building away from everybody else. So they've done a great job with limited resources and really trying to make sure that they are able to quarantine and do some social distancing measures with the clients at that shelter. At the same time, the state has stood up 2 different facilities that have the ability to quarantine people or do isolation with people that either have mild symptoms and are positive, or they have been exposed and they need quarantine. And as of the end of today, we've had, at any given time, we have, 6, 7 people either in hotels or in one of those facilities. So we are also assisting with taking some of those people that may have tested positive or been exposed and putting them in a quarantine setting that is set up for success. And that looks different for every person because someone may need services with that. If someone needs mental health services or addiction services, we try to put them in a setting that they can be successful in because they have those services available.
Clarify, are they all in hotels, or has the
No.
Laconia site been used? What's open now in terms of your sites?
The Laconia site is being used right now. We've had no issues with that site. It's been very successful. We've been using it since Monday, Tuesday of this week, and then we also have people in hotels.
Can you just clarify, you said very few people tested positive. Can you give us an
2
idea?
statewide. We have 2 unsheltered people in the state that have tested positive that we are aware of. I mean, there is also it's a fluid number, right? So that we are aware of. There's 2.
One other bit on numbers. It appears that the known cases in Coos and Grafton counties have been pretty steady for the last week or so. Is that due to lack of testing, the success of social distancing, absence of community spread? Do we know?
I don't think we have a good idea. I can let Dr. Chan take that.
Thank you. So the bulk of the infections, the cases of COVID-19 that we've identified have been in the southern and southeastern parts of the state, and largely that's likely where the population density centers are. We are looking at expanding testing around the state, not just in the southern, southeastern parts of the state. We are looking at how to certainly increase access to testing in potentially underserved areas, wherever in the state that may be, but that includes areas of the North Country as well. What I will say is that we have distributed one of these Abbott rapid analyzers to one of the hospitals in the North Country in Coos County, so that they have more local capacity to do testing. But we will continue to work with the hospitals and healthcare agencies around our state to make sure that they have the appropriate equipment, personal protective equipment, swabs, specimen collection supplies, so that even if there's not an analyzer or a lab instrument, so to speak, in a certain area, hospitals, healthcare agencies can and should be able to at least collect the specimen to send either to a reference lab, a commercial lab, or even to the state public health laboratory. So in answer to your question, I think it shouldn't be a lack of testing. Any provider in the state, any hospital in the state has the ability to appropriately collect specimens. I think part of the reason that there are lower numbers in some of these less dense areas is exactly because there's less population density, and that essentially incorporates some amount of social, physical distancing into communities.
Dr. Chen, did you say that the 3 new deaths that you reported today, were those all in long-term care?
Yes, the 3 new deaths reported today were all associated with some type of long-term care or congregate living setting outbreak. Yeah.
Thank you. Governor, on the Reopen for Business Committee, I was looking through the names there. I didn't see if there was a doctor. I'm not sure if anybody who was on there is a doctor. If there's no doctor on the committee, wouldn't it be a good idea to have somebody there who could pump the brakes if their idea is going too far in one direction?
Everything the committee recommends will come through not just my office, but the Department of Public Health. So I guess we didn't want to, I don't want to say waste a spot by putting someone on the Department of Public Health right there. We're looking at the business leaders to kind of design those plans, but then everything comes through, not just Dr. Chen, but his entire staff, and we'll review it. It'll all get reviewed from a public health benefit, to be sure. Do we have some on the phone? Some folks on?
The first question comes from Kathy McCormick of Associated Press. Kathy, go ahead with your question.
Yes, thank you. I have a couple of questions about contact tracing. How many people are working on contact tracing in New Hampshire? Is it just state employees? And are more people needed at this time to assist with that?
So the question is about contact tracing and how many people we have currently working on contact tracing. Do we need more? So to answer that last question, as we increase testing, we're going to need more people. Our public health staff is able to currently keep up, but there are some people obviously working, long hours to make sure that anybody who tests positive for COVID-19 gets a phone call, has an investigation performed. Again, to repeat the way that this works is we get all reports at our public health agency of anybody testing positive for COVID-19. That gets assigned to an investigator who reaches out to that individual to collect information, including date of symptom onset, what type of symptoms, where this person has been, who they might have come in close contact with, and then we then need to reach out to this individual's close contacts to notify them of a possible exposure. So when someone tests positive, there's a whole chain of events that happens to not only make sure that the person diagnosed with COVID-19 is isolated, but to ensure that the close direct contacts are then told to quarantine because they've been exposed and could at some point in 14 days come down with symptoms of COVID-19 themselves. This obviously takes personnel. We have the number of people who are working on a combination of contact tracing and monitoring, so following up with people who have been quarantined or isolated, is approximately 30 individuals or so currently. That's a subset of the larger number of people working overall. We are looking at trying to increase these numbers over the coming days and weeks, potentially doubling or maybe even tripling the number of people. So recognizing that we're doing more testing, we're going to need more staff. We're keeping up right now. It is busy, but we are working on bringing on new staff to accomplish that. In terms of who we're bringing on, it's a combination of people from other areas of the department who we're training up. We're working with other providers through agencies that we have a contract with, like Convenient MD. We are working with the National Guard, for example. So we're really looking to bring in additional personnel from many different areas to staff up the unit that is going to be getting these positive test results so we can do the appropriate contact tracing and public health investigations.
The next question comes from Pat Grossman, a freelance writer. Pat, go ahead with your question.
Hi, good afternoon. My question is about the testing of people who use the homeless shelters across the state. I know that they do testing at Manchester's facility, but is testing going on at any of the other shelters across the state?
I'm going to let Commissioner Shibinette respond.
Thank you for the question. So we deploy a variety of methods to do testing at shelters. The testing at the Manchester shelter is probably the one that's most visible, but we have tested unsheltered people from many areas of the state, including setting up testing for Keene, setting up testing both this week and next week in the Seacoast area, and so it's really absolutely in other parts of the states too. But we don't always send a team in to do the testing. Sometimes it is one or two people that don't have close contact with others that can go to a Convenient MD and have their testing done. So we are in contact with the shelters on a regular basis, and if testing needs to be done, we happily deploy any of our methods to go and get that done.
The next question comes from Michael Graham with InsideSources.com. Michael, go ahead with your question.
One very quick question is, could we get more demographic information about people who've been hospitalized? We have the racial breakdowns yesterday, but a lot of us are still interested in both age, not just over 60, but maybe more specifically over 70, over 80, and then also comorbidities, because there seems to be a very strong correlation to hospitalization and comorbidities. And the second question is, I'm trying to understand the talk about, well, by June we'll be in one spot, or in a few months we'll be in another spot. Just yesterday, CDC Director Robert Redfield said there's the possibility that this winter will be worse than what we just went through, because we'll have the flu epidemic and the coronavirus epidemic at the same time. The point is that the coronavirus itself is still going to be among us no matter how long the lockdown lasts. It's not going away. All we've done is spread out when people are going to catch it. And so the theory was, once we flattened the curve below our healthcare capacity, that was as much as we could do. Are you saying that if we stay in long enough that at some point people will just stop catching it as often, or it will become less virulent? Aren't we going to have the same net number of infected people by Christmas, whether we end the lockdown tomorrow or in October?
So the quick answer to that is, obviously this is incredibly fluid. No one knows where we're going to be next week or next month. I think the CDC has done a good job trying to get people prepared for this concept that there could be second or even third significant surges. They could be even more significant than we are today. But remember, what we're doing is setting up these new guidelines, testing capacity, ability to have PPE, in all the different aspects of whether it's business or our life or our lives. They're in long-term care facilities, in healthcare facilities, hospitals, so that assuming we do have some aspect of the COVID virus in our community for the long run, in the long run being 2 months, 6 months, or 9 months until there is a vaccine, until we get to zero, we are setting up these new guidelines so that we can flex out of some of the more rigid constraints we've had to put on things. We put a lot of these constraints on because some of the testing hadn't even been designed. If you remember, 2 months ago, the COVID testing was just really coming out of the box and being understood what it could be. We're just getting antibody tests discovered and understood now. I think there's 3 or 4 of them. They're not very readily available at all. It'll be interesting to see how those tests become more readily available, how we integrate them into these models, integrate them into everything from our colleges and universities to our communities, to see who has it and who does it. Who doesn't? There's a big unknown what this, we keep talking about this term herd immunity, how many people really have to have it to really suppress the viral spread on a more natural basis. But my goal here in the state is to get these guidelines and these plans up and running so that if we hit a second and third surge, we're not just going right back to where we were a month ago, because that was pretty devastating, that we can actually manage ourselves through it, maybe make additional flexes in our guidance documents. But yes, the long answer there is we are likely in this for quite some time, but we're trying to develop these new models of normal so that society can go on, so that we can flex out of it a little bit, so that we can integrate ourselves and manage through it a little better than we had in the crisis that we were a month ago. Even though we're going to be with this virus, the point is to try to get to a point where we're not just reacting to the crisis, but truly managing through it, and that allows us to have a little more flexibility in our lives and our workplace.
The next question comes from Abby Trombley with Monadnock Radio Group. Abby, go ahead with your question.
Hi, Governor. We were wondering what the state plan is to help the university system. UNH, Keene State, Plymouth University, because they're kind of stuck in limbo and not sure if they're going to have a freshman class. And we were just wondering what the money assistance is as well.
So it's a great question. The question is, where are we going with our university system? That's a big unknown. Let me take a step back and first answer a little bit on a national level and a philosophical level, and then we'll talk about New Hampshire. I'm a firm believer that even before the COVID crisis hit, our university system was going to go through some pretty major changes over the next 5 years. You're going to have a lot of universities that were financially on the edge, that were potentially going to go out of business, and that's on a national scale. There was a national study done, I want to say about a year ago, that identified the potential for 30 to 50% of mid-sized universities to potentially disappear in the next 5 to 10 years because of finances. And then you add the COVID crisis right on top of that. The COVID crisis is really another piece of there's 4 major pressures coming on to the higher education system. One is economic, and that's been exacerbated by the COVID crisis, the fact that you're going to have less revenue from states to put into the community college or universities, potentially. One is technological. More folks are rapidly going to online learning systems, not just K-12. We've already had online diploma-type programs, and I think those are being accelerated, and more folks that traditionally would not have looked to that path are looking at that path. You're going to have just physical infrastructure issues. As less students potentially are on campus, how do universities change their models to allow for that level of education allow for those opportunities and experiences that you need for that full diploma education before you enter the workforce. And so therefore, how are we going to manage our infrastructure on that? Do you need all the physical buildings? How do we integrate our community college system and our other tiers other than the state university, the private universities, and the community colleges, our secondary and adult education programs? Is there a whole new model that we have to look at? I think there is. I absolutely think there is. I don't know what that model is, but we've challenged both the university system and the community college to work together to see if there are new models to allow our students to get that high level of education, to get those diplomas, but also give them the flexibility if they so choose for either an online part of their education being online, part of their education being integrated into the workforce. I just think it's a whole new model, and it's not just a change that the state is going to have to go through. It's what the faculty is going to have to look at, the infrastructure, the spending, the cost basis for a lot of those institutions. They're great institutions, but everybody needs to, I think, have a moment, take a deep breath and say, this is a whole new world that we're going into. And I think those universities and higher education systems that embrace those changes first will be the most successful. And so I'm very enthused in that we've talked to members of the board on both the university system and the community college here in New Hampshire. We've kind of put the message out to the private colleges and universities here to really challenge themselves to look at those new models, because they have to. It's the right thing to do. It's how they're going to not just survive, but I think provide a quality integrated 21st century education. That might mean making some tough choices on their side in terms of cost, expenditures, contracts, professors, how they do it. I also think I was speaking with Secretary Betsy DeVos about this, about we rank all of our institutions of higher education. We don't really rank them on the quality and level of success in terms of the online learning. That's such a very new thing. So how do you quantify that? How do you tell a parent that this level of online path might be better or more suited for your child than this one? And I think just speaking as a parent, it's something that I would like to know, and I think a lot of parents will want that data and information to help their families make the choices that are going to best meet the needs of their children and where they want to be in the workplace and what their future holds. So there's a lot to that, and it's a really, really important question, to be honest, and it's something that we're looking at kind of behind the scenes, but we got to come up with some pathways here in really short order, because we don't know what September is going to look like. It isn't just a matter of just pounding more money into the system, the same way of doing it the old-fashioned way, and expecting the same result. That's going to be a recipe for failure, I think. I think you have to kind of grab the bull by the horns, embrace the opportunity, challenge yourself to how to create a new model, and I think that's how you're going to get the best results for your citizens and your students.
The next question comes from Rick Juergens with the Valley News. Rick, go ahead with your question.
Yes, thanks. Regarding the nursing home staffing question, the guidelines that allow COVID positive staffers to work in some limited situations in the nursing homes are limited to facilities with, quote, critical staff shortages. So could you tell us what percentage of the state's nursing homes and assisted living facilities currently are working with, quote, those critical staff shortages?
Thank you for the question. So right now we are aware of 2 facilities that are either using this or at least discussing using this type of staffing strategy, and they are working collectively. They work hand in hand with either their local public health department, if it's Manchester or Nashua, and or our division of public health here at the department. So we only know of 2 facilities that are using that, or talking about using that. They may not actually be using it, but they've been discussing it. Critical. Those would be considered your critical areas. Many nursing homes across the state right now, both those with COVID positive patients and even those without COVID positive patients, are still experiencing staff shortages. That's not new due to COVID, but it is certainly exacerbated due to COVID.
So your reference to Manchester and Nashua, does that mean that your facilities are Hanover Hill and the Huntington?
No.
No.
I think it does it for the online questions, but if folks have... Sure.
We're hearing from some parents who are curious about the phased reopen of the economy and childcare for kids who are too old for daycare but too young to be by themselves. What's going to happen for those families who've got those, 8 to 11-year-olds who can't stay home by themselves and the parents have to go back to work at some point?
So the question is really about a lot of the kids that are too old for childcare but too young to stay by themselves. I'm going to take a step back and give you a bigger answer. One of my biggest concerns, what we're dealing with now and trying to plan for the future, not just in terms of how we open schools and what that looks like, is that with all the success we've had of remote learning, there's a lot of kids falling through the cracks. There just are. Less in New Hampshire probably than any other state, but one is too many. All right? It's one of those issues where you just say one is too many. And so maybe it's the certain special ed services. We have a lot out there, but there are certain districts that are having trouble doing that. And that's understandable. Remote learning is a very different setup. Sometimes it requires a parent bringing a child into a facility, and maybe that parent is working, and so that child can't get those services as, they might be being provided, but, we can't physically get there. Sometimes those services translate online or over, a Skype maybe. Sometimes they don't. Sometimes, especially for occupational therapy, the OTs and the physical therapists that are often required for a lot of those services. My fear is that you have a lot of kids falling through the cracks. Combined with that is the issues of mental health. Kids have done an amazing job over the past 2 months dealing with remote learning, but it is stressful. And I can already see, not just, it isn't my family per se, but I've heard a lot of stories out there of parents contacting me in different school districts all across the state. They've worked hard, they're right there, but it is exhausting. And I think there's a lot of frustration because the kids want to go back to school. They want to integrate with their friends. When you take out that social aspect that a child really needs often to thrive, it really creates a gap in the ability of the child sometimes to focus, to get certain things done, to follow all the way through, to expect a child to go through the 6 hours of traditional learning that they get in a classroom and just let it translate into the kitchen table is incredibly difficult. It creates a stress for families, and you get different levels of mental health issues on that spectrum of anxiety, of stress, of frustration. And then you compound it with economic issues onto a family. And then you compound it with a lack of social interaction for that child. And then you compound it with just the natural anxiety of this massive pandemic where, people are getting sick and they're dying. That's a huge stress on our entire system. And the kids the people that I think face the brunt of it the most, not just on the physical side of the pandemic, but on the mental side, are the kids. Now you add in to the segment you're talking about, those kids that are too old for childcare, really too young to stay by themselves. And again, you're finding another huge gap of kids. You're talking many thousands of children in the state that fall in that demographic that are sometimes home alone when they probably shouldn't be or have trouble doing so, or they're going to work with their parents if the parents are bringing them to work and trying to do online learning while their parents are at the office or something like that, for those who are going to work right now. There's so many strains on the system. I think what we're going to find, unfortunately, is that over the summer, let me add one more problem to the whole mix. Now you have a lot of kids who rely on summer programs. Maybe there's summer camps, the Boys and Girls Club programs. How do you actually implement those without getting massive transmissivity of the virus? Now you add the summer school programs, which a lot will go to remote learning. But again, now you're asking kids to be in a remote learning atmosphere from April all the way through to September. I mean, that's a big ask for a child to take on, and as a parent to manage that. So the compounding effects of all of this are absolutely huge. I think we're going to find as we go through the summer and into August that there's a lot of these gaps, there's a lot of need for services, and that's why I talk about the sacred cows. If we have to make tight budget cuts or certain constraints or delay certain funding on certain programs, I can tell you what, it won't be for kids programs. If anything, we're going to boost those up because we have to recognize that it isn't just about the end dollar to the state. It's about providing services and making sure that these kids don't continually fall through the cracks and we create more long-term problems for them and their families. So I can tell you it is the utmost concern. And then you add the child abuse issues, and then you add the domestic violence issues on top of it. I mean, we keep going down a path, and this has really compounded itself. A lot of people will tell you that when you add all that up, you've heard that term, is the cure worse than the disease? Well, no. I mean, this pandemic is real. People are dying very drastically from it. But the indirect effects of what's happening, and a lot of times communities and families won't even realize it. If it's not happening in your house, you're not maybe seeing it, but it's real and it's out there and it's happening to thousands of kids across the state. So it's something that we're going to stay very vigilant on. It's why I talk so much about CASA, why I talk about trying to get certain programs up. We're talking, we've been able to maintain a lot of our child care centers, maybe about a third or more of them, with the additional stimulus dollars we've put into the system. But we need more, frankly. We need to expand their opportunities. We've allowed businesses to create their own child care programs within their business entities, so kids can come to work, to give parents a little more flexibility and a little more comfort that their kids aren't just going to be staying at home when they probably shouldn't be. But I can tell you it's going to be an absolute focus of us from a month ago, to the indefinite future, because this isn't something that gets solved with just money. Isn't something that just gets solved by allowing kids to go back to school. There's a lot of pieces of this puzzle that have to be put together to make sure that all of these kids that have fallen through the cracks are accounted for. And it's our job to make sure we account for everyone. It's a tough one. Didn't mean to go on, but man, it's a passionate subject. It really is, and it's something that we don't talk about a lot, but boy, it is out there, and it's only going to get, those anxieties are only going to get heavier and heavier. So, look, we appreciate everyone spending some time with us this afternoon. We appreciate all the questions. One of the things I always go back to is, in times of crisis, the best thing you can do is be incredibly transparent with what you're doing, incredibly rapid with the relief efforts that are coming. And again, we got a great team at the state, not just the folks that you see with me here today, with Dr. Chan and Commissioner Shibinet. From David, his team, all the way on down. Everybody has really come together in the state to try to deal with these issues. They're very serious. We're not getting through it tomorrow or even next week, but we will get through it. We'll stick together, and maybe even with some positive weather, there'll be a few more smile on people's faces. And if we can find the flexibility to get the economy or our communities and our homes opened up a little sooner, then we're absolutely going to do that. So we appreciate everyone having the patience and the vigilance to stick with a lot of these stipulations as long as they have. We'll get through it. Thank you, guys.